My name's Chris Anderson. I'm an orthopedic surgeon at Tennessee Orthopaedic Alliance, and I specialize in sports medicine and hip arthroscopy. Hip arthroscopy is a minimally invasive procedure where we use small incisions and a camera that goes into the joint, and using that technique, we're able to correct structural abnormalities that are in the joint at that time. In terms of what patient we treat for this, it's generally in active individuals of many different age categories, but the determining factor really is the degree of arthritis they have in their hip. If they've got a lot of arthritis in their hip, we don't recommend they do hip arthroscopy. If they don't have arthritis and they have structural damage, they may be a candidate for an arthroscopic hip procedure. Generally, hip arthroscopy is used to treat conditions within the hip joint, such as labrum abnormalities. The labrum is a small gasket of tissue that goes around the socket and provides a suction seal like an O-ring would, and we're able to go in there arthroscopically and repair labrum injuries.
So the first part of this operation is really just gaining access to the hip. You can see this thing is just really shredded up, and you can see this little junction here between the two of them. He's got a lot of cartilage damage as well, so pretty serious hip injury here.
I chose to start doing hip arthroscopy because it was an interesting new field at the time, and I like being on the cutting edge, so to speak, of techniques and helping people out.
Looks good.
So one of the things that we're doing here at TOA with our hip arthroscopy patients is we're using a new table that allows us to lay the patient backwards into a position where we actually use gravity to pull the hip into distraction.
We're going to level the table now that we don't need the traction anymore,
which helps eliminate risks that are traditionally used in prior techniques where they have to use a post between the legs, which has been shown to cause nerve damage and other problems.
Good.
And using this new technique, we are minimizing the chance of having those complications occur. Preparing for hip arthroscopy is pretty easy, I think, for the most part, talking with your surgeon about it and understanding as much as you can about the procedure so you're prepared of what to expect afterwards is maybe the most important thing you can do. In addition to that, I think it's important to maintain a healthy lifestyle, continue to exercise up to your symptoms, what they tolerate, and just talk to your doctor and be prepared. So generally, after surgery, we start physical therapy within 1 to 2 days. Following that, we do therapy ongoing for several months. It's usually twice a week, and then we will check you back at frequent intervals to make sure you're progressing according to the postoperative plan. So my personal mission for each patient is to provide the best possible care I can for them, and to be excellent in terms of our surgical technique and diagnostic ability, and to help get them back to their best possible life that they can, and so they can do the activities they want to do and be happy in life.